Hello, I'd like to take the opportunity to talk to you about cleaning for health and infection control. Today we know all buildings are complex environments, and they can contain a large diversity of microbial flora, or bugs. These bugs can come and cause risk to employees, patrons, students, patients, visitors. And transmission of these bugs can be intricate and complex in terms of, do we touch surfaces and contaminate ourselves? Have we eaten something that has now made us sick? Transmission within healthcare facilities can be more severe than non-healthcare facilities because of the patient population. So is this a cost of doing business? If we look at today's statistics, healthcare-acquired infections account for nearly 2 million infections and cause almost 100,000 deaths each year. To the bottom line, that accounts for $20 billion to our healthcare tab. If we look at a 6-day perspective within businesses, well, studies show us that $660 per employee can add to our tab. Sick days, in fact, cost employers over $1 million per year. In a school perspective, funding that we get is a huge component of how we educate our students. Reimbursements by districts change, but generally range between $25 to $30 per day. And so if I take a population of a district that has 50,000 students getting $30 per day, if we have 1% absenteeism, we can lose $15,000 per day in funding. During the pandemic, where we had absenteeism up to 35%, that accounted for $525,000. So what is the take-home message I want to get across? Well, there's a lot of scientific evidence to prove that microbes survive on fomites or surfaces. Like Darwin, think of survival of the fittest. We know that microbes can be transferred from the environment to surfaces or to hands. I don't want your cooties. Wash your hands. Association between the exposure to fomites and infection. So if you touch something, you may get infected. And of course, from a decontamination perspective, we need to clean and disinfect these surfaces. So just clean it. Prevention is the key to minimizing pathogen transmission. Collaboration is a key component to the successful infection control program. We need to collaborate, whether we're in a hospital between environmental services and infection control, in schools between custodial staff and the school districts, or from a business perspective between building management and our occupants. We need to develop a robust environmental services program that includes the appropriate allocation of resources which is necessary. So in conclusion, we know environmental services can certainly improve the bottom line. It's become clear that the greatest potential for improvement within our healthcare and education facilities lies in preventing infection transmission. We don't need to find a new cure. Cleaning and disinfection of surfaces helps to minimize the risk of transmission.
To view more quick clips, visit ISSA.com.